Good afternoon, students. So I'm going to make a video for you of chapter 21. That's our blood vessels and circulation chapter. I have it, the PowerPoints here on my computer, and I'm going to be going through them with you. And I hope that you will bring up the PowerPoints also, and you can follow this video along with the PowerPoints and get a clear understanding of the different topics and anatomy and physiology discussed in the chapter. So this will be chapter 21. This will be blood vessels and circulation. And I'm using the PowerPoint that is available to us in our Blackboard site through the portal. So this is about blood vessels. It's the third part of the cardiovascular system, meaning we did blood, we did heart, and now we're doing blood vessels. And some of us have already discussed a little bit of this in class, but I'm going to take it from the beginning so that the picture is complete and everyone is on the same page. And as I go through, I will call out slide numbers, let you know what slide I'm on, so that you can follow along clearly with it. So first thing I'm going to do is I'm just going to go past the learning objectives in the beginning and talk about, slide number 1, which is slide 4. That's where we start, at slide number 4. And that's the introduction. And basically what it's telling us is that there are arteries, there are arterioles, there are capillaries, there are veins, there are venules. There is a complete circuit of vessels that begin at the heart and return to the heart. The critical or important component of the circulatory system is probably the capillary bed. Right? We could argue any part is important, but the capillary bed is where exchange of nutrients between the blood and the tissue cells of the body take place. Cells are going to receive oxygen, cells are going to receive nutrients from the blood via the interstitial fluid, and cells can then get rid of wastes, and any secretions, hormones that are made by the cells can then be entered into the blood and carried away from the tissue area. So the exchange vessels, the capillaries, are where the important physiology of the system takes place. So they're introducing on slide 4 how blood vessels are described based on their size or the different components of the wall, so on and so forth. They're starting with the 2 largest arteries of the body, which would be the aorta coming off of the left ventricle, and the pulmonary trunk with its 2 right and left pulmonary arteries coming off of the right ventricle. Then they go on to talk about different sizes as we move away from the heart, as we move away from those vessels. We're going to get smaller and smaller branches coming off, leading to the capillary beds. So those are the largest arteries. There's also 2 large veins. There's the pulmonary veins, which come from lungs to heart, carrying oxygenated blood back to the heart. And you also have the superior and inferior vena cava, which are delivering deoxygenated blood from all the tissues of the body back to the right atrium. So I'm skipping through 5 because they're defining what an artery is, an arterial, a capillary. I'm passing slide 6, and I'm going to jump right to slide number 20. Okay, because slide number 20 is kind of a pictorial illustration of these different vessels that are part of this systemic circuit. So at the very, very top on the right, they start with large elastic arteries. Large elastic arteries would be arteries that have a lot of elastic tissue in the wall. Okay, and as we go through the construction of the wall, which we'll do shortly, you will see that these large arteries have 2 very robust elastic membranes. What's an elastic membrane? It's interwoven elastic protein fibers, elastin, that gives the vessel the ability to quickly increase its lumen, increase its size as it receives blood from the ventricle and then easily recoil back to its normal shape, pushing the blood forward, and no damage occurs to the wall. These are these large elastic arteries, and you could guess that they would be the aorta and the pulmonary trunk and the right and left pulmonary arteries. Branches coming off of those, okay, would then become smaller arteries. Well, would become what they refer to as muscular arteries. Muscular meaning the wall contains much more smooth muscle tissue than elastic tissue, right? So the elastic arteries emphasize the ability to stretch and have flexibility. The muscular arteries emphasize the ability to constrict, contract, control the smooth muscle cells, controlled by the sympathetic nervous system, can cause a vasoconstriction, can cause the muscular tissue to contract, squeezing the blood and moving it forward. So coming off of the aorta, you're going to see large branches. Then you're going to see medium-sized branches. Then you're going to see smaller branches of these muscular arteries. Coming off of the muscular arteries, more branches, different sizes, leading to the arteriole. The arteriole, as you can see from the picture, is quite different than the last two. Meaning, if you look at the wall of the arteriole, you see just smooth muscle cells around the arteriole. And, of course, the lining, the endothelium. It's a very, very simple configuration of a vessel. A little smooth muscle and a little lining. The arteriole is the last vessel before you get to the capillary bed. They lead to the capillary beds. And then at the very bottom of this picture, you will see the capillaries. Going into a capillary bed is oxygenated blood. Coming out of the capillary bed is going to be deoxygenated blood. And then it starts to make its way back to the heart. So coming out of the capillary bed, it goes into a very small vein called the venule, which is similar to the arteriole. Not as much smooth muscle tissue in the wall as the arteriole, just some connective tissue covering. Then that moves to small veins, medium-sized veins, large veins, okay, that have some smooth muscle tissue. According to our textbook, no elastic membranes. And then we move to the largest of the veins, which would be superior and inferior vena cava, going back to the right atrium of the heart. So it's a nice picture that kind of lays out the different types of vessels from the start, the heart, through the complete circuit, through the capillaries, back to the heart. Okay. Now I'm going to backtrack for a moment. Okay. Going to go to slide number 7. Slide number 7 now takes us to a little bit more detail. About the construction of a vessel. So now we kind of just looked at the size and how it goes from large to medium to small to capillary. We kind of looked at the size and the flow. Now, what is the true difference between an artery and a vein? Or an artery, arteriole, capillary, venule, vein? What we find in the wall of the vessel is what differentiates one from the other. What we find in the wall of the vessel also is going to determine how the vessel functions. For example, in a large elastic artery, we find a lot of elastic tissue for stretch and recoil, stretch and recoil. In a vessel that has a lot of muscle tissue, we find a lot of ability to constrict, vasoconstrict, squeeze the blood, push the blood forward, and so on and so forth. So all vessels, with the exception of the capillaries, with the exception of the arterioles, have these 3 main components. And you see them on slide number 7. Tunica intima, tunica media, tunica externa. Now all vessels, all have number 1, tunica intima, the lining. So tunica intima, as the slides will go on to tell you, and I'll just flip to the next one, number 8, tunica intima. That is the lining of the vessel, the lining. And what is the lining of the vessel? A simple squamous epithelial cell called the endothelium, with then a little basement membrane around that, and then some areolar tissue around that, and that's the lining of a vessel. Okay? Now, if you compare artery to vein, as they do in these slides, you will see that in an artery, there is an internal elastic membrane associated with the tunica intima. What is that? Well, in addition to the endothelium, in addition to the loose areola, there is now a layer of elastic rubber band-like protein fibers surrounding that. And of course, you know what that does. That allows the vessel to expand rapidly, absorb a lot of blood pressure, and then quickly recoil back to its normal shape. So that's the tunica intima of an artery. Tunica intima of a vein, no internal elastic membrane. Has the endothelium, has the connective tissue layer, the areola, but no internal elastic membrane, because veins do not need to rapidly expand, accommodate blood of high pressure, and then recoil. The next slide, number 9, tells us about the tunica media. And what is tunica media? Mainly muscle cells, smooth muscle cells, tunica media. Okay, concentric layers of smooth muscle that can be controlled by the autonomic nervous system, by the sympathetic motor neurons, which can tell the cells to contract, causing a vasoconstriction. Both arteries and veins have smooth muscle. What we see in an artery, though, is a second elastic membrane. The external elastic membrane is in the tunica media, and it's just like the internal elastic membrane. It is interwoven elastic fibers that allow for rapid expansion, absorb high pressure, and then recoil back to its normal shape. Veins, as our book states, does not have that. Now, there may be some veins in the body that do have an elastic membrane, but for our purposes, our book states the comparison between artery and vein. Veins do not have elastic membranes. Arteries do. So the middle layer can be controlled and can change its tension, smooth muscle tension. Now, what we see as we go into the arterioles, remember, is we lose a lot of the smooth muscle. There's some, but little. As we go to the capillaries, no smooth muscle. Okay, and as we come out of the capillary bed into the venules, not much smooth muscle. You know, if it's there, it's a little bit. All right. They finish with slide 10, tunica externa. Tunica externa is a covering, right? It's a connective tissue covering that has some collagen fibers, has some elastic fibers in the veins of the body, maybe a couple of smooth muscle cells in the covering. This is the tunica externa. Again, found both in veins and in arteries. No tunica externa in your arterioles. No tunica externa in the capillaries. That's all gone at that point, all right? Think about a capillary. Capillary is a single squamous cell. The wall is a single squamous cell. It's one cell thick, a little basement membrane around it. That's it. No other layers, no other components. Why? Because the things inside of the vessel need to be able to move out of the vessel through those cells. One cell layer, as you learned when you learned about epithelial tissue. When you have a simple arrangement of cells, it's so that transport, secretion, resorption, filtration, things of that nature can take place. We can move things from point A to point B, move things out, move things in, easier. You have a stratified many layers, that type of movement is not going to take place. And so it makes sense. Everything about the body, as you know, makes good sense. On slide 10 also, they mention something called the vasa vasorum. The vasa vasorum is the vessel of the vessels, right? Meaning some of these large blood vessels have multiple layers, have many cells, and do those cells require oxygen and nutrients? Of course they do. Where are they going to get it from? from smaller blood vessels that actually supply the cells of the larger blood vessels with their needed nutrients. So that's the vasa vasorum. Okay. So then you have on 11 a nice picture that compares the characteristics of an artery to the characteristics of a vein on slide number 12. And in the center, okay, between the artery and the vein, there's a picture of both of them together side by side. And you can see a lot of things in that picture. What do you see? Well, first you see the lumen of the artery, and you see the thick muscular wall, and you see that the artery is very well maintained in its shape with a, small lumen. Next to it, you see the vein, this fairly amorphous shaped vein, quite large, not really holding its shape very well. The lumen is at least 5 times that of the artery. All right, so it gives you a comparison of the structure of the wall. Great. The other thing that it indicates is something we talked about with regard to the heart, that the amount of blood in the vein compared to the amount of blood in the artery is quite different. There's much more blood in the vein. We call that venous reserve. And we then applied venous reserve to venous return, meaning if we could mobilize some of the blood from venous reserve out of the vein and back to the heart, we could increase venous return to the heart. And if we increase venous return to the heart, then we could influence cardiac output. All right, we talked about cardiac output. CO, cardiac output, equals heart rate, HR, times stroke volume, SV. And if we were to manipulate heart rate or manipulate stroke volume, or in other words, manipulate EDV and diastolic volume, the amount of blood in the ventricle prior to contraction, we could manipulate cardiac output. So you see now the comparison between the two and the sizes. So in slide 13, they make a written comparison, right? We did a visual comparison, a written comparison of arteries and veins. There are some things maybe here that we didn't mention. Veins have valves, so especially the veins of the legs, like the lymphatic vessels of the legs, there are unidirectional valves that allow blood to move in one direction but prevent the backflow of the blood. Veins have that. Okay. The other things that are there, arteries have thicker walls, higher blood pressure. We're going to talk about blood pressure quite a bit, but obviously smaller lumen, the ability of the muscle to constrict and push on the blood would generate a higher pressure. Also, arteries are coming off of the heart. The heart is creating the highest pressure of blood. That blood is entering the arteries. Pressure should be higher in the arteries, and obviously less in the veins because the veins are further from the heart. Here on slide number 14, they introduce vasoconstriction and vasodilation. I've been referring to it. Vasoconstriction, sympathetic motor signal to the smooth muscle cells of the wall, causing the muscle cells to contract, squeezing the blood, putting a greater pressure on the blood, and in return the blood pushes stronger against the wall, creating a greater blood pressure, forcing the blood forward towards the capillary bed. And the opposite, vasodilation, that is relaxation of the smooth muscle, take away the sympathetic motor signal, relaxation, lumen increases in size, pressure on the blood decreases, systemic blood pressure decreases. Vasoconstriction, vasodilation, and its relationship to pressure. Slide number 15 brings up a word that we had discussed in the cardiac heart chapter, afterload. All right, so they have afterload, peripheral blood pressure, capillary blood flow, as it relates to vasoconstriction and vasodilation. Well, we just said vasoconstriction increases peripheral blood pressure. Increasing peripheral blood pressure increases the flow of blood to the capillary. Great. And what about this afterload? Well, remember, afterload means the amount of blood and the pressure that that blood creates in a vessel. So the amount of blood in a vessel creates a pressure within that vessel. Now, we used this term afterload with respect to the heart. For example, the left ventricle, when it contracts, has to squeeze the blood and create a pressure that is great enough to move the blood out of the ventricle. We know that the AV valve closes, but that pressure forces and pushes the semilunar valve open, the aortic semilunar valve. Now, in order to push that valve open, behind that valve, there's blood. There's blood in the aorta. That blood in the aorta that is creating a pressure is known as afterload. We have to overcome afterload to move the blood out of the ventricle, open the semilunar valve, push the blood that's in the aorta out of the way, and put new blood in it. Afterload is determined or created by blood in a vessel and the pressure of that blood within the vessel. So they're saying here, vasoconstriction, if you're squeezing a vessel, which is squeezing the blood, that's increasing the pressure of the blood, will increase afterload, and the heart will have to work harder. Hence, hypertension. Why is it bad? Heart has to work harder to move blood through the system. Slide 16. This is leading up to that picture that I had skipped to, right? 16, 17, 18, 19, and then slide number 20. 20 is the beautiful picture showing you all of the different sized vessels and how they all fit together. Okay. On slide number 19, they throw in a pathology, aneurysm. Aneurysm is when there's a weakness in the wall of the artery, right? Usually it's a larger artery, right? But it could be any vessel. The elastic membrane, that elasticity and stretch and resiliency is lost. So the pressure in the blood pushes against the wall, pushes against that weak spot, and it begins to see a little bulge. The wall begins to bulge because it's weakened and lost its integrity. Okay. Because of that weakened wall, over time, possibly could swell more, and possibly one day it can break, can tear, which of course would lead to bleeding. So these aneurysms, in vessel walls could be quite dangerous. So they mention that pathology. Okay, I'm skipping to now slide number 24, which gives a little bit about capillaries, because capillaries are going to be our most significant component, right, where exchange takes place. And what we have said is, again, going to be reiterated, meaning they're the smallest. Their walls are made up of endothelium only, a little basement membrane perhaps over it. You realize capillaries are microscopic. They are woven between all of our cells. All cells are in contact with capillaries except epithelial cells and cartilaginous cells. And because of that single cell wall, exchange, transport, movement from blood to interstitial fluid or interstitial fluid to blood takes place easily. 25 talks about the structure. Endothelial tube, no elastic membrane, no muscle tissue, just simple squamous cells. They go on to talk about, on slide 26, 27, 28, and then pictures on 29, so I'll leave it on 29. They talk about the different types of capillaries that exist in the body. So there are continuous, there are fenestrated, and there are sinusoids, or sinusoidal capillaries. All right? Continuous means the wall is complete. The endothelial cells are locked together. There's no gaps between them. Movement is through the endothelial cell, meaning things inside have to move through the cell to get out. We use properties of diffusion, osmosis, membrane transport mechanisms to move things. They're found throughout the body. They're the most common. Fenestrated means there's little pores, little fenestrations or pores between the cells. Little ones. Well, that's perfect. That means that things can easily move through those pores. They don't have to deal with the cell and its membrane. They can just move in and out through the pores. Makes it easier to transport things, right? To move things. The sinusoids, well, that's a takeoff on the fenestrated, except that in the sinusoidal capillary, there's huge gaps between the cells, allowing things to easily flow in and out. Big things can move in and out, right? So if I go back for a moment, just mentioning 26, they talk about the details of a continuous capillary. And it may be important to take note where it's found. It says found in all tissues except epithelial or cartilage, because there are no vessels in those tissues, right? And they tell you a little bit about how things move. They give you some examples, like the blood-brain barrier, okay? So it's good to take note of these slides and read them and understand the difference between continuous, fenestrated. Well, here on fenestrated, they tell you about the pores and they give you examples. You find it in the choroid plexus, the endocrine glands, kidneys, intestinal tract, meaning the place in the brain, choroid plexus, where cerebrospinal fluid is made, in endocrine glands. In the kidneys, where we're going to ask the kidney to extract stuff from the blood and turn it into urine. So we want that to be an easy process. In the intestinal tract, where we're going to want to absorb nutrients from the food that we ate into the blood. So you get the picture. In areas where transport is critical, is a foundation, you need to have vessels that can do it easily, right? And then they finish with sinusoidal, right? And they give you large gaps in between the cells, a free exchange of water and large proteins. And again, where are they found? Liver, spleen, bone marrow, endocrine glands. These are areas that are filters in the body, where we want as much fluid in the blood to easily flow out into the parenchymal cells, into the cells of the liver, of the spleen, that can then process, treat, filter the fluid in the blood. All right, they move on then to capillary beds. And I think what I'll do now is I'll stop the video, or about 28 minutes, and we'll then pick up with a part 2 and then a part 3 and so on and so forth. Okay, so look forward to part 2.